New research says Black women have a higher risk of dying from breast cancer compared to white women, and the data suggests systemic racism is partially to blame. Stephanie Stahl explains.
It's been an uphill battle for Spring Williams, diagnosed with stage 3 breast cancer.
Very scary, especially when you are healthy, feeling healthy, looking healthy.
The South Jersey mother of 2 was just 41.
I went through chemotherapy, surgery, and radiation.
That was a year after she found a lump that her first doctor said wasn't breast cancer. You were misdiagnosed.
He was confident that it was a cyst.
She believes racism may have delayed her diagnosis. New research says it's part of the reason why Black women are more likely to die from breast cancer compared to white women. The study from Massachusetts General Hospital says there is a 17 to 50% disparity depending on the type of breast cancer. Black women with hormone-positive tumors have the highest risk of death. Erica Warner led the study.
Across all types of breast cancer, there's something that is driving this finding of consistent disparities between Black and white women.
The study says beyond tumor differences, the disparity is also caused by socioeconomic inequality, inadequate access, and systemic racism.
The bias is pervasive at all levels.
Breast surgeon Monique Gary, who runs a wellness farm, says the new research is the largest to date outlining disparities.
We've got to do a better job of treating women the same.
Spring, whose breast cancer battle isn't over yet, says discrimination detailed in the new research is an unfortunate reality for many.
It makes me sad, but it also makes me hopeful that things will change.
It's change that could save lives.
So Stephanie Stahl is joining us now to talk a little bit more about this study. Hi, Stephanie. It's good to see you. It's been a minute.
Hi, Anne-Marie.
So let's talk about the study, because the fact that Black women are more likely to die from breast cancer, I think that is something that we already knew, but it seems like this study really drills down on the causes.
Exactly, it did, and it talked about systemic racism and discrimination. And the researchers of this study that was very large and comprehensive says this is a call to action, that change needs to happen so that all women are treated equally.
Mm-hmm. And, you know, you identified some of those ways in which systemic racism can have an impact. You talked about, you know, sort of access, there's, you know, income, socioeconomic status, but then what about just medical bias, which is something that transcends whether or not you're educated or you have a good income and quite frankly, transcends race often. Often women are treated differently. Were they able to identify issues with medical bias as well?
Well, they are, but as you know, that is hard to calculate exactly. What happened with Spring is her doctor made his diagnosis based on a mammogram and an ultrasound. Some would say she should have had a biopsy and an MRI to find that cancer earlier. Mm-hmm. She had to be her own advocate, find another doctor who went on to have an accurate diagnosis of breast cancer. So the big takeaway in this is that you need to be an advocate for yourself.
100%. And before we let you go, I want to ask you about something new. The Food and Drug Administration expanded the approval of a new drug to treat patients with earlier stages of breast cancer. That seems like a good thing. What can you tell us about that?
Yes, this drug, Kidcali, was originally prescribed for women with metastatic breast cancer. Now the FDA says it can be used at earlier stages of breast cancer along with other treatments. Now, how many people this might be able to help, unclear at this point. It's something surely that people should talk to their doctors about, and perhaps another treatment option for them.
And you know, when the Food and Drug Administration approves something like this, I mean, if you're a patient, can you go to your doctor today and ask about it, or is it something that usually takes a little time?
Well, you certainly should talk to your doctor about this. What this drug, what they're saying it can do is, along with other treatments, it might be able to prevent a recurrence in some women. So it's something clearly women should talk about. Patients, breast cancer patients, should talk to their doctors about.
All right, Stephanie Stahl, thank you so much.